Well, welcome to Facebook Friday. Happy Friday. It's Linda and Dr. Gordon. Oh, it's not Dr. Gordon. It says Dr. Gordon. Who are you?
I'm Susan.
Yeah, Susan is one of our newest members of Southeastern for Fertility, and our NEDC patients will recognize her as well. She is being Dr. Gordon's on the spot, Jamie on the spot, not Johnny, in the clinic. She takes Dr. Gordon's patients back, helps him with procedures. So Susan, let's tell all of our millions of viewers out there. Tell us a little bit about you. Where did you come from? Are you from Tennessee?
No, I was born and raised in Colorado Springs, and I've been in Tennessee since 2019.
Okay, well that's a pretty long time. How's the accent coming on?
It's going real nice.
Good. You're getting there. You're getting
Yeah.
there.
What did you say earlier? Something I've been practicing for a while is driver's license.
Yeah.
Yeah.
Driver's license.
You don't say driver's license. No, driver's license.
Driver's license.
I love it. I love everything about it.
So, how I know we have like foothills instead of mountains. I'm always told by people from Colorado. But are you liking the area?
It's so beautiful, so green. It's almost hard to go back now because it just feels so barren. You know?
I did have a couple that was from Utah earlier
Yes,
this
similar.
week, and they were talking about how the mountains in Utah
Yes, we
are
were talking
more
about.
barren as far as not as many trees and things. So.
Yeah, it's definitely more tropical feeling here. Warmer, which is nice.
It is warmer, I'm sure. So tell us a little bit about you professionally.
So, I obviously went to college in Colorado Springs, and I have worked OB/GYN for my entire career. So definitely dabbled in fertility, but really diving in with you guys, and I'm loving it so far. So,
Well, good.
yeah.
Well, she's doing a great job. I can tell you that. And she is wonderful. She's fitting in here just great. With that East Tennessee accent coming along nicely. And then it's pretty outside today.
It is. It's lovely.
Just gorgeous. The cool weather this morning. It's great. My favorite time of year. So, tell us a little bit about you have kids, husband,
No.
crazy
I
ones.
just- I have two
Been telling the
kids.
stories this whole time.
And of course, a husband, and we all came out here together. We're all adjusting. My kids are a little bit older. I've got a high schooler and an 8th grader.
Okay.
So they love it too. We just couldn't be happier with our
Oh, good.
decision.
And we have a comment from Becca who says, Nurse Susan is the best. Love her.
See, there you go. We love her too. So we're gonna keep her. She can't go anywhere else. We're gonna keep her.
Yeah, it's my jam. I'm loving it. It's definitely a great
Good.
extension to my background, and so much that you think you know, but there's always so much more to learn, which is
So what was the most important thing that we have learned you since you got here?
learned me.
Yes.
Most
About
important
Dr. Gordon.
about Dr. Gordon. He likes Jamocha shakes.
Does he really?
Yeah, wasn't it?
And
I
Diet Pepsi.
I didn't know that.
And you have to fuss back at him just every once in a while. Right?
Yes.
Right.
Yep.
You guys do that.
I do it all the time.
I'm learning. I'm just dipping my toes in. I like to test once in a while.
He told me if you ever have concerns when he first came here, just come and tell me. So I knocked on his door one day, and he said, yeah, and I said, you have a minute? And he's like, sure. I shut the door and I said, are you out of your ever-loving mind? And his eyes went, and he's like, what? So you might not want to do that, but I was a little concerned because I have hospital experience for Jacob. You have too, I bet. Yeah. And our embryology lab is now certified by Jacob. And it was when he first introduced the thought of having Jacob come and certify our embryology lab. So I was thinking of all the things that had happened in the hospital and all the nightmare it was trying to get ready for him and do this and do that, and it has to be a certain way. And it's all going to be fine.
Been
But
good.
he doesn't ask me for things anymore unless he really wants to know the answer. You know?
He doesn't really ask your
He
opinion on
just, no, and he just says, "You okay?" And when I say yes, he says, "Okay, good." He doesn't jig.
I like how he said he's a slow burn, but then when he erupts, it's like laying nuclear waste to everything.
Yeah.
I mean,
Yeah.
those are his words,
Yeah,
not
those
mine.
are his words.
He said that just this week.
But you know what? He really is a slow burn. I think he's
Yeah.
very, very tolerant and very easy to get along with. He's a good doctor to work for.
He is, yes.
He's been so patient with me fumbling around and figuring things out and not always having the answer right away. So it's been a great experience.
Good. And I will say too, Dr. Keaton, when I started, I had no idea of anything I was doing because I came from 23 years of oncology. I didn't even have OB/GYN. So it was just like, I felt like I'd graduated from nursing school again. And he didn't have nurses that were here to teach me IVF because I was the IVF nurse. So he basically had to train me from start to finish, and he had to check every protocol I did for the longest to make sure it was okay. And it was just like, he was very patient with me too.
And look, now you're the rock of the IVF program
Oh,
for the nurses.
well.
Hands down, for sure. You've been immeasurable to me. Every time I need something, I go around the corner.
You can always ask me. I might tell you the wrong thing, but you can always ask me. Anyway, that's it for Facebook Friday. Loved having you be introduced on it.
Yay.
Have a good weekend, everybody.
Bye.
Bye.